common morbid obesity comorbidities for morbid obesity is hypertension, heart disease, diabetes, sleep apnea.
Yes.
But these can happen without morbid obesity as well.
Absolutely.
Makes it like which starts first in these cases?
So, of course, you can have a person who is very thin and they have diabetes. Of course, you can have a person who's very thin and they have heart disease or hypertension. And very often these are related to genetic factors more than anything else. But when we take heart disease, high blood pressure, diabetes, currently in our population, in our society, it is by far the type of disease related to morbid obesity, right? And how do we know that, Kamal? We know that because there has been a parallel increase of obesity and the prevalence of these diseases in our society, right? So if you go back to the 1960s and 1970s, the level of obesity in the United States, Kamal, was about 10%, 10 to 12%. This is, if you go everywhere in the United States, people with a body mass index greater than 30 would be about 10 to 12%. Now it is 35%. And along with that increase in the incidence of obesity, we've also seen an explosion in the incidence of high blood pressure, cardiovascular disease, and diabetes. So yes, of course, you can have those diseases without obesity, but the type of those diseases we have currently in our society by far are related to obesity. That's why addressing obesity makes a lot more sense than us chasing each disease on its own, because it's inefficient, it's very costly, right? And the results are not as good. Why not address head-on the root cause, which is obesity currently in our society?
What we find in our daily case conferences, when patients start, they don't even sometimes know that they have these conditions. True. So how many times we diagnose people with diabetes because their A1C is like out of control. They have sleep apnea and then they think that they're just snoring, but no, they do have sleep apnea. And then we have so many patients, we actually diagnose them at the time of after the initial consult. So the awareness of these issues, like do our patients know that they have these conditions, or do they get used to having them so that they don't actually feel the issue anymore? Because if they didn't come for this bariatric surgery consult, they wouldn't maybe find out for these issues for a long time.
Absolutely, absolutely. If appropriate tests are not done, very often patients will find out that they have these conditions when those conditions have reached an extreme level of severity, right? So it is not uncommon for patients to present with a stroke as a consequence of high blood pressure that has been going on for too long and has reached severity now. Because, as you know, high blood pressure does not give you any symptoms unless you measure it. You do not know that you have high blood pressure. But then when the high blood pressure has been going on for so long and it's severe, it could suddenly give you a stroke that could give you debilitated, right? So those diseases sneak upon patients in a very, very, very dangerous way. But also, Kamal, if you think about it, obesity itself also sneaks upon people in that way, right? How common is it for a person to look at themselves in the mirror every day and not realize that their weight has reached very high levels? Very often, they kind of lull themselves into thinking, yes, they've gained weight, but it's not that severe, right? And then symptoms start appearing, right? Somebody may have struggled a little bit with weight and they've doubled with some diets, but then over time, the weight actually, whether it's 5 pounds or 10 pounds every 1 to 2 years, it accumulates to levels that are very high. And perhaps their first presentation to their doctor may be, or I have knee pain now when I walk, or I cannot breathe well when I'm going upstairs, right? So the doctors will see them, and maybe they have postponed this for a long time, and maybe their blood pressure is being measured for the first time then. And then bingo, the blood pressure is skyrocketed, right? And the doctor may do blood tests at that time and find that their A1C is also very high. Now they have type 2 diabetes, right? And the doctor may ask them about their sleeping patterns, and they may say, look, it's been that I don't sleep very well. I fall asleep during the day. I take naps very often. And my partner tells me that I snore like there is no tomorrow. And they do tests, and suddenly now we find that they have sleep apnea. And at that time of evaluation of their high blood pressure come out, they may have an echocardiogram, and the echocardiogram suddenly may show that there is weakness of some of the chambers of their heart, because heart disease has also developed, right? So suddenly a person who may be middle-aged, who thought of themselves very healthy, except the fact that they have a little bit of weight, suddenly they find themselves confronted with the fact that they have to take so many medications and they have to go to so many specialists, right? And what is the key here? The key is that the weight has crept up on them. And then the other interesting thing, Kamal, and this is also very human and natural, is that people are afraid to weigh themselves because they kind of are worried to find out where they are.
No, so I'm one of those people.
We all are, right? Come on, to some extent, right? Because we don't want to see that scale, right? And then when they see, and then their doctor will say, look, you actually have morbid obesity. You may be a candidate for surgery. And they say, what are you talking about? Surgery for me for weight? Because they associate bariatric surgery only with, my 600-pound show, that show where there are people who really are extremely obese and they undergo surgery. And yet they are actually the ones who may benefit now, because they've crossed that threshold of obesity where now they have developed all these illnesses. And then the more you talk to them, actually, the more you find that there are many other illnesses. They may have migraines. They may be feeling depressed because of the way they feel and the fact that they don't have energy and the fact that the weight may be affecting their relationship now, right? They may have heartburn. They may have fatty liver disease, right? They may have gout. They may have other joint problems, back pain, all a constellation of symptoms come out that are all related to obesity.